Hello, 531 class. Dr. Hastings here. Hope everybody's having a good start to their week. Albeit quite different from last week with the chilliness. It's remarkable. You might notice I have a fleece on actually right now. I'm recording this from the practice that I work at part-time. I wanted to say that I'm pleased and proud of the group as a whole as per how you've navigated curricular design from the beginning, more generic ways of looking at framing a curriculum, and into the more specific things this past week, making it a little bit more practical and applied, a lesson plan, which is universal across academic and institutional hospital-based settings. At least is my hope. Again, I get the impression that that's not always the case in either setting, but can be utilized and a good tool, and I think people did a nice job with that assignment overall. So this week, we have to consider what really ties this all together, the idea of evaluation. And why does evaluation matter? Well, it's sort of like what we say relative to nursing practice with documentation or care planning. If you don't document appropriately, then it's like it wasn't done. And what meaning does it have? In the end, these assignments are meant to be threaded across a curriculum, i.e., the idea that we start big again with goals. We consider the learning outcomes that we need for our students in a given type of program, undergraduate, graduate, hospital-based for new orientees, or for novice nurses, let alone seasoned nurses with annuals. And then we consider in all this, what do we do to specifically impact the type of outcomes that we want, i.e. specific courses or modules, and even drilling down to assignments that speak to course or module objectives. So that's what we were really doing last week a bit. And in putting it all together, evaluation really is the part of the process that brings it together. Now, today we're talking about how do you evaluate students at one level, as does the DQ. So it gets a little bit more specific, more small ball, so to speak. But by the same token, in all this, we're keeping in mind the idea that these kind of courses and assignments within a course have to link back to a bigger program. All right, so the linkages are really critical, and I think we had that last week. Certainly one of the lessons planned was really good in terms of addressing linkages. So that's an important piece. The other thing we're talking about here is not just evaluation of a course or module in terms of performance, student performance, or learning on, again, a cognitive, affective, or psychomotor domain. And we'll get a little bit more specific for some of this even when we're talking in the next few weeks, in particular when we get to the part on clinical instruction. But for the program, evaluation of our program effectiveness. And that's why the first week we had all those links that were associated with the big drivers, the accreditors for our programs. AACN with CCNE, NLN, all that, and ANPD if we could get at it. Understanding what are we accountable to in terms of the components of instruction for a curriculum. What is a curriculum trying to get across, what it's trying to do? So now we're going to evaluate that. So there's two pieces here in effect this week. Individual student performance evaluation to see if our teaching is effective, but overall, all the pieces, the courses within a curriculum, what do they speak to relative to program effectiveness, the goals for the program, and our learner outcomes that we want to achieve. What are we trying to do? Undergraduate, pretty clear. Proficiency with NCLEX, we need students to pass the boards. Got that, and all the pieces they get us there. Those competencies, those basically essentials competencies that we're trying to get at that support the practice standard for professional nurses. And it's a little bit more specific or a micro level with hospital institutions and what they're trying to get at necessarily. So, all right, let me just flip through the slides pretty quickly to sort of frame this. All right, so curriculum evaluation. Look again at goals and outcomes. That's a critical thing. The courses are the building blocks within this. And we're drilling down, just like we were talking about in the lesson planning last week, teaching and evaluation strategies, let alone all the infrastructure stuff, all right, including policy. Those that get a chance to go to a curriculum committee meeting, and I know 2 of you did, so kudos there. Get that on your radar if you haven't already gone. That's really a good way to see how policies are alive. All right, and then in all this, we're thinking about, from a program perspective, the student learning part that we're trying to get at with our courses, but also satisfaction, and also faculty performance credentialing in a program evaluation. And these are those latter chapters in Billings and Halstead, by the way. And at this level, you're thinking about a systematic program evaluation. Where does that go to? So think about that chapter content and just glance at that. That's not really, the most important thing, but to have an appreciation for the breadth here in terms of introducing this topic this week, it's important to think about it and how that rolls, and the in-process stuff with formative, let alone summative endpoint evaluation. So important things. Okay, remember, it's a process, so we're thinking broadly initially. All right, the ultimate goal in all this is to teach to some type of outcome effectively, so that students learn what our goals are, well, relative to our goals, or learn what we're selling, so to speak. So I think it's all about how that process unfolds. So think about the steps relative to evaluation process. So right now we are talking about program evaluation. Purpose, timing, an evaluation team, a framework for that, collecting data, which should be ongoing, all right, and then reporting out the findings. So these are the kind of things that the accrediting bodies like AACN and NLN do. They come to, and ACEN up to this point for procedure crest, they come to the institution and they're looking at that systematic evaluation. How did that unfold? And does it indicate, based on the data, that we're meeting our goals and learner outcomes? That's really important to consider that. And we do these things based on accrediting agencies telling us they're coming and that you need to be evaluated. And they're on cycles. It's 10 years for having a good accreditation standard for those big drivers, AACN and NLN. But when new things take place, course revision, new courses on board, new program, then we need to do that again, in effect, then too. So anyway, or if we're doing a curriculum revision that needs to sync to national themes or standards that we're concerned with, thinking about things that we talked about in the past, IOM, thinking about Benner, and those big drivers that push to healthcare, in effect, then too, that we need to do some things differently based on safety and quality consideration. And magnet, of course, that type of thing. And too, does that influence what we do at an institutional hospital-based level for programming? So look, for purpose, seeing Billings and Halstead 387, the whole notion of how do we look at evaluating how we facilitate learning at one level as we start to drill down in terms of the nuts and bolts of a curriculum and its effectiveness. Our standards, as in essential competencies that are linked back even bigger to scope and standards of practice with nursing or healthcare in general, thinking of those terms. So we'll get back to systematic program evaluation later, but in starting this lecture content, we need to consider that because that's the overarching standard that we're referring back to from a process standpoint. All right, so the evaluation itself should be based on context. We think about it in the program student and faculty performance, to have an effective program, in effect. And then within the context of the academic theme, that's fairly self-evident and clear based on what we've talked about before, the links that I've provided, to the accreditation agencies like AACN and NLN. ANPD, again, I'm very transparent, not really sure. They're pretty locked down. And the ANA content relative to professional staff development is pretty limited. But again, in talking to some of the agencies that I've consulted, St. Luke's and Lehigh Valley and Geisinger, they do refer to their direction and that some of their program evaluation is influenced by big quality indicator entities such as Magnet, Six Sigma, Hospital Corporation of America, Joint Commission, Medicare. Those are influencing factors relative to the programs that are being implemented in effect then too. Think about the outcomes for the training. I know my video is covering something based on the goals and objectives, just like for classes in academic settings here for institutional. we tweak them based on context. So if we're talking about nurse or medical residency programs, if we're just talking about annual trainings, we're talking about new employee orientation, those things matter. All right, when to evaluate, always a question mark. Relative to new things arising, we already touched upon that before, let alone some timeline for being due for accreditation or due for review. A good framework, one of those that's been out there for a long time, Stufflebeam's model. It's one that's referred to quite a bit. So think about this from a process standpoint, how that works, but it does touch upon the idea of context, let alone to input, process, and product. So a very relevant model that's used by many in academic and institutional settings. So the evaluation process, consider the way in which we do this. Questionnaires, attitude scales, and rating scales for student feedback, for sure, and interviews, checklists, portfolio artifacts. A lot of this will relate back to such things as exit interviews for people exiting the program, but even on a yearly basis while students are in a program, to have course evaluations or end-of-year evaluations that may be pertinent to getting feedback, reasonable feedback. So what do students think of our programs? Hence, that's the nature of how we frame these things. We want to get their input. So it's not just looking at their performance, but we want to understand how do they feel about the program in terms of reaching their own goals. So that matters in context. But if we want to talk this for student performance for a minute, think about the goal. What are we trying to do? It's going to look different for undergrad versus graduate in terms of the competencies. Professional nursing at the baccalaureate level, we want them to be safe and effective, but relative to that level of scope of practice versus graduate, much more sophisticated, and relative to, again, the essentials that are framed at the graduate level. And for healthcare systems and professional development specialists and educators, think about what we need to do to get our new nurse employees or our ongoing folks on board being safe and effective, especially with new innovations in care that are being presented and are unfolding. So, what kind of instruments and assessment skills do we use relative to student performance? Well, just what we've been thinking about when we were even doing lesson planning last week. Learning on the cognitive, affective, and psychomotor level. How do we effectively evaluate that? So there was an evaluation column in the lesson plans from last week, thinking about how that drills back. And always think, just like we do in like care planning, objective and measurable types of behaviors, then too, that can be assessed. So performance in an exam actually is a behavior. Think about it from the didactic context, let alone on the things that we can relate to better with psychomotor skills, certainly, with labs and hands-on types of things, hands-on skills, let alone the affective part, a little bit more nebulous and harder to measure, but still important to do. So in the cognitive domain, I'll just sort of roll through these quickly, and I know some of this slide is going off the page, so look at that on your slides posted. And differentiate between, again, academic versus institutional settings, what the needs might be. Look about what we're evaluating relative to the cognitive domain, and consider some of the nuts and bolts of things, including tests and test questions, that type of thing. And here's an example of an NCLEX-based question that's commonly used. It mirrors the boards. We're trying to basically parallel or simulate the board experience a lot of times with our didactic test questions. And then consider in all this, the process and a prudent way, that really the pedagogy for creating test questions and delivering tests. Consider the validity of test questions. That's an important consideration. And here's just a few examples of not just multiple choice type tests, but again, best response, hot topic. Drop and drag type of experience is also a hot topic. So psychomotor domain, we'll talk more about that with clinical instruction within the next couple of weeks. Consider this. And the affective domain, harder to measure, but still an important consideration. I think of process recordings in psych, because that's what we do a lot of. And then, of course, simulation, we talked a lot about. That's at the top of the list for a pedagogy that really tests all these domains. And I would offer other things like concept mapping that I think a lot of people who've taught in clinical do, let alone reflection, and of course even papers. So these are the considerations relative to the specifics, and then systematic evaluation plan. Reinvest in that. Get back to these latter slides that refer to the models and the process for those types of experience. Okay, that's it for me. I wish you well this week.